Hello everyone. I'm excited to introduce you to Trajecta Medical. We are redefining safety in lung biopsies. Imagine having a scary, invasive test to check if it is a lung cancer. A long needle is pushed deep into the chest. Sounds scary, right? But if that isn't scary enough, 1 in 5 biopsies fails. The needle sometimes punctures the lung and makes it collapse. It is called pneumothorax. Sometimes, in other times, there is no enough sample to diagnose. The consequences are severe. In pneumothorax, the patient can barely breathe, and a chest tube is required. It extends the hospital stay. In other cases, when the diagnosis there is non-diagnosed sampling, another biopsy is needed, or in worst case, the tumor continues to grow. So today, a CT scan is performed to locate the lesion and to help the physician to plan the trajectory. He plans the trajectory manually on the image, and then he tries to insert the needle based on the planned path. So the static approach can lead to those side effects that I mentioned, which are pneumothorax, and the tip of the needle miss the core diagnostic zone, leads to non-diagnostic sampling. So why does it happen? When the doctor drives the needle to the lung, he cannot take into account the critical anatomical burdens that are almost invisible to his sight. But they lead to suboptimal trajectory or a dangerous one. But in the medical literature, those trajectories are known, but they are invisible to his sight. To make this more complicated, the lungs move when the patient breathes. So it's even more complicated to insert the lung to the specific path.
This is why we developed the Trajecta navigation platform. Our platform helps the doctor to find the safest and most optimal path even before the procedure begins. Then it guides them to hit the target with pinpoint precision, completely overcoming the breathing challenges. So no more guesswork, just accurate biopsy for the first try. So how does it work? The Trajecta combines 2 smart steps. First, AI planning. Our software analyzes the scans, and it trains on thousands of cases to instantly find the safest, most successful path to the tumor. Second, laser guidance. In the room, a dynamic laser projects the exact path right on the patient's chest. The laser are dynamically adjusted in real time, showing the doctor exactly where to go. So let's talk business. We are targeting a massive high-growth opportunity in healthcare. The lung biopsy accessory market in the US alone is valued at almost $4 billion. And more importantly, the navigation system represents the fastest growing segment within this space. So here we are today. We are already completed our in vitro and customer validation with 5 leading doctors in the field. And now we are launching our retrospective clinical trial in advanced engagement with a leading hospital in Israel. So this is our team. Dor and I come from both medical and AI worlds, combining the clinical background with data science. And we are also very fortunate to be backing by a leading medical expert in this field, Dr. Ofira Vital. And so if you are interventional radiologist or early-stage investor in these fields, you are more than welcome to join to our journey. For quick and instant access, you can scan this QR. And if you want Perfecta, choose Trajecta. Thank you very much.